He is 77 and she 69, a blessed couple to still have each other. Together, Mr. and Mrs. Tan have crossed life's many hurdles and fought against several battles. Their last victory was against a most dreadful enemy, cancer. They each had a different kind.
那时我大便里面呢，有点血咯。我以为是痔疮嘛，所以我买这个中成药来测。你测了啊，2个礼拜又没有血咯，就以为是痔疮好没关系。后来超过2个礼拜又来，我想这最好是给西医检一下咯，检一下看怎么样咯。
Colorectal cancer develops in the large intestine and presents no apparent lump on the body. A silent killer in that by the time symptoms appear, the cancer is usually at its advanced stages. Mr. Tan Gi-woon was diagnosed with stage 2 rectal cancer in 2001 and was told that to save his life, a surgery was essential to remove his anus, rectum, and the surrounding muscles of the anal canal. This would mean that bowel continuity cannot be restored and he would need a permanent colostomy.
After the first shock of being diagnosed with colorectal cancer, the popular question that patients come to ask is, do I need to wear a bag? And by bag, they actually mean a colostomy, where you actually bring out the intestine to the skin and you connect a bag and you actually move your bowels through the bag.
这是换个带很辛苦的，你有时你看你去那里啊，你要注意，它会一满你不知道的，它会流出来的，很有味道的这样，所以很麻烦的。
The incidence of colostomies in the old days was about 20 to 25%. If a patient has been diagnosed as colorectal cancer, his chances of ending up with a bag about 20 to 25%. But nowadays, with more expertise, with surgeons or doctors who are better trained and do these procedures much more commonly, and also with technology, we have better instruments, we have surgical staplers and all, we're able to join back the intestine and then obviate the need for a bag.
Fortunately, after seeking a second opinion, Mr. Tan had a rectal surgery and was spared from having a colostomy. A chemotherapy cycle of 6 months was to follow, and Mr. Tan was on his road to recovery. But shortly after the first month of chemotherapy, his eldest son, Tan Chek Ken, complained of stomach bloatedness. These are footages of Tan family on a Channel News Asia program in 2001.
When they present with stomach bloatedness, it may be a sign of obstruction. The cancer is grown so big that it may obstruct the intestine, so they become bloated. The other possibility is sometimes the cancer may spread to the lining of the tummy and causes water to accumulate within the tummy and thus causing abdominal distension. And both these are usually caused by more advanced tumors.
Sadly, at the time of diagnosis, Chek Ken's cancer was at a stage more advanced than his father's. He had stage 4 colon cancer that was spreading fast to the lymph nodes and liver.
大医生就问我，他说：“安迪，2个人你可以照顾得来吗？2个病人呢，说你要看你儿子、你先生的这样。”我说：“我可以了，我可以照顾。”我有时候6点多就到医院了，到晚上差不多9点多、10点，我这个小的儿子才带我回来。会累也是儿子病了，什么都没有想到累的时候了，也没有想到自己会累了，只是整天想流眼泪，就是整天流眼泪。
9 months later, in 2002, cancer claimed their son at age 39.
一定想念的，你的儿子为什么不会想？一定想念你，想念。时常想哦，小叶，我这个算的，他时常坐这个椅子嘛，时常看着椅子也在坐在那边。你看病时开始坐这个椅子，很孝顺的，很孝顺的，很照顾了，照顾我们2个人。我的儿子过世了，我就是现在还是挂着他。
还是放不下。一个做妈妈的儿子，从小带到大，他不是很顽皮，还是很乖，每个人都很疼他。养到他长大，养到他结婚，我就安心了。料不到他有这个病。
But before their wounded hearts could heal, cancer took a third strike, this time on her. In the same year their son died, Mrs. Tan was diagnosed with breast cancer after a random health check at the mobile clinic parked near her home.
为什么不是我得到先，儿子来照顾我？为什么我年纪大要来照顾儿子？我自己得到癌症，我已经年纪那时候得到癌症还是60多岁，我一点我都不怕。
Colorectal cancer, or cancer of the large intestine, is the commonest cancer in Singapore today. It is the #1 cancer affecting men, and for women, it comes second after breast cancer. Close to 1,400 new cases are diagnosed every year, and more than half of those affected will die from this disease. Although more common in people 50 years and above, doctors say colorectal cancer can occur at any age.
The truth of the matter is that everybody is at risk. Our rates equal the United States and the UK as being one of the highest in the world. But within the general population, there are certain groups which are at higher risk than others.
People with elderly, people who are older, people who have a high-fat diet, people with family history of cancer, people with personal history of polyps. One more group is the people with inflammatory bowel disease, and last of all, people with this very rare hereditary cancer. One we call it HNPCC.
With both his parents and only sibling affected by cancer, Chek Jiang is among those who fall under a group known as Hereditary Non-Polyposis Colorectal Cancer Syndrome, or HNPCC. People under HNPCC have 3 or more relatives affected by cancer, coming from 2 successive generations. At least one of them affected before the age of 50, and at least one of them diagnosed with colorectal cancer. They have a 50% risk of having colorectal cancer, that is 45% higher than the average Singaporean man.
We're talking about people who actually have a family history of colon cancer, a higher risk of colon cancer because of other cancers or other diseases. I think the best thing that we generally recommend is colonoscopy. And colonoscopy is putting a scope into the anus and rectum and actually looking at the entire large intestine.
Good morning.
After losing his brother to the cancer, 40-year-old Chek Jiang, with 2 boys of his own, leaves nothing to chance. He goes for a colonoscopy once every 3 years. One day before screening, he must empty his bowels so that the doctor gets a clear view of the inner lining during the test. Sedation is given before the test, and the screening procedure takes about 20 minutes.
We're actually looking for polyps, which we believe that are the precursors of cancers. It is most effective because, firstly, we get to see the colon clearly. Through the scope, we are able to magnify, we are able to take closer looks, we're able to clear the view by washing the area, to suck up areas which we're not sure of and take a long, hard look at certain things. And then we also have the ability to biopsy and remove tissue. And what is most effective really is that it's a one-stop procedure in a sense that if you find a polyp, you actually can remove the polyp fairly easily with instrumentation through the scope.
Because the colonoscopy is an invasive procedure, it carries a small risk of colon wall perforation. However, doctors regard it as the most effective method of screening that has proven to reduce mortality risk by 33%.
It's generally accepted that the risk is small enough for us to recommend it for screening. There are, of course, other radiological tests like X-rays, like the barium enema or the CT colonography, which help us to image the colon, to see the colon. The disadvantage of all these is that if you find something, you still have to proceed on to the colonoscopy.
To his relief, no abnormalities were detected this round.
Until now, they don't find any, you see. So actually, I'm not so worried. Yeah. And with the regular screening, I think it does help, you know, to assure me that, you know, in case it does happen, you'll be under control, you see. Normally, let's say we can arrest the cancer in the early stage, the chances of survival is very high.
Although genetic inheritance is proven to be one of the causes of colorectal cancer, 75% of those affected are people with no family history of disease. Sue Chu just happens to be one of them. When diagnosed, her colon cancer was already in stage 4 and had spread to the liver. One who always watches her diet and goes for regular health checks, Sue Chu was in denial of the prognosis and wondered how the cancer could invade her body that quickly. Via the circulatory system in our bodies, 80% of stage 4 colon cancer metastases is to the liver, as in Sue Chu's case. As blood passes through the capillaries to deliver oxygen and collect waste material from the large intestine, it circulates through the liver on its way back to the heart. Once cancer cells detach from the colon and enter the bloodstream, they have to reattach quickly to tissues in the nearest organ in order to survive.
If they are not treated, without any treatment, we usually will give an estimate of about 6 to 9 months. Currently, with good treatment, with just chemotherapy and new targeted therapies, most patients live up to about 20 months to about 2 years.
Before my cancer, I took life for granted, that I will live a long and healthy life with a stable job and retire comfortably. Cancer has now changed my perspective, and I feel that it was a wake-up call.
In 2004, Sue Chu was admitted to hospital and had to undergo an emergency surgery. She knew that she had advanced colon cancer only on the day of discharge. But there were still spots in her liver that did not respond to the treatment she was having then.
One of the greatest challenges was to face up to reality that my lifespan was limited due to my contracting the advanced colon cancer. The toughest part was to tell my father the news that I had cancer. I was comforted that he took the news calmly and was very touched when he advised me not to worry and to take good care of my health.
Driven by her loved ones, she was determined not to give up searching for anything that could extend her life. One of them was Qigong, a cultivated practice of physical postures, breathing techniques and focus intentions. Touted the alternative complementary medicine for cancer, it did make Sue Chu feel better. But the cancer cells within her were still waging war.
Through the many decades of research, we now identify certain cancer genes. These are the genes which promote cancer growth. And we know that in certain cancers, these genes exist. And because we are able to deliver certain antibodies targeted at these genes, we are able to switch off the gene, so to speak, and make the cancer less aggressive, such that it doesn't grow so quickly, and make it more susceptible to the killing by our chemotherapy.
In the year 2005, she found hope. Her cancer responded well to cetuximab. Cells receive signals from other parts of the body that cause them to grow and divide. The signal, a protein called epidermal growth factor, passes through EGF receptors that capture and transmit growth signals to the cell. By binding to the EGFR on the surface of both normal and tumor cells, cetuximab blocks the receptor from receiving these signals that would otherwise cause the cell to grow and divide.
Actually, I do not have much effects like losing hair, vomiting and nausea. I believe with the advancement in medical treatment, the side effect has been really minimized. For me, there was actually very little or none at all.
With the new targeted therapy, the tumors in Siu Chu's liver shrunk quickly and a surgery was planned to remove part of the diseased liver. It is also called a liver resection.
In this particular group, there is a 1/3 or 33% chance that they may actually be cured if they go for a surgery. But this is only limited to the liver alone or the lung alone.
Hi, Siu Chu. How's everything?
But a liver resection is a major undertaking, and there was a need to ascertain the exact site of metastasis.
You look at all your results. This is the PET CT scan before we started the chemotherapy. You can see there's a tumor in the liver. It lights up as a bright spot. These are the PET CT scans you can see. The bright spot is already gone after the chemotherapy.
Please lie down first.
Positron emission tomography, or PET-CT, is the latest scanning technique that combines an anatomical scan with a functional scan.
In a PET-CT, we inject the tiniest amount of sugar. This sugar is tagged on to a radioactive substance. We know that cancers use sugar, they metabolize sugar, they are very fond of sugar. And when we inject this tiny amount of radioactive labeled sugar into the system, they will preferentially go to where the cancer is and light it up. So even very, very small tumors that may be 2 millimeters in size, can be picked up on a PET-CT when it cannot be picked up on a CT scan. In Siu Chu's case, we were able to use the PET scan, number one, to establish that truly the only site of metastatic disease was in the liver. Number two, it was also very useful to guide us in saying that truly our combination of chemotherapy together with the monoclonal antibody was working very well for her. And thirdly, we are now using the PET-CT scan to show that she remains in remission and has no evidence of cancer recurrence.
So, for a cancer fighter like Siu Chu, what is life like going forward?
I know I had advanced cancer and the possibility of recurrence is great. Therefore, I treat each day as a bonus. I take things less seriously and also set my goals more realistic. I try to maintain a more balanced diet and a healthier lifestyle than before. So now I eat more vegetables, fruits, grains, nuts, eggs, with some lean meat and seafood. I eat more in moderation now, with occasional indulgence in cakes, still my favorite. Exercise is now part of my daily routine. Previously, I was doing exercise probably twice a week. I also spend more time with my family and my passion for traveling. I hope that my cancer will be in remission and for a long time. I also hope that I have more time to volunteer my services to cancer patients so that I can encourage them to live life well, physically, emotionally and mentally. What had happened was not important, but the road before me was to live life to the fullest, be happy and healthy.
Siu Chu is one of many advanced cancer survivors who've benefited from the recent advancement in medical research. For Chet Ken, who passed away in 2002, targeted therapy for colorectal cancer was not yet available.
In the past, metastatic colorectal cancer or stage 4 colorectal cancer was considered as an incurable disease. But now through research, we have now identified a certain subset of stage 4 patients, those with colorectal cancer with spread to only the liver. And we know that these patients, even though they are stage 4, with aggressive chemotherapy, aggressive surgical intervention, many of these patients can be cured of their cancer.
While there is no single way to prevent colorectal cancer, doctors agree that screening is the only way to ensure early detection and successful treatment of the disease.
Seeing my brother going through that process, I find that he's a very strong man. He has a very strong character and strong will to live. So kind of encourage me to move forward and to be more proactive in life, and take care of ourselves.
现在好像放松了，看淡了，都是看淡，因为好了好像赚来的，是不是？你现在你活的一天就赚了一天的啦，所以我也有看到我的孙现在所以觉得很幸福了，没有遗憾了。